forward in terms of, is lowering the age of consent one of them? Is it some exemptions? Is there any specifics in terms of what recommendations that both organisations are making in relation to dealing with what is a complex problem? I would just be happy to hear from both of you.
Okay, thank you. And Shannon Rowe, Jillian van Turnhout.
Thank you very much, and thank you to both organisations and to both presentations. And I certainly would agree about the importance of balancing the welfare, the well-being of a child and the protection. Very often when we talk about children's rights, people just focus on protection, but protection is only one aspect of children's rights. And certainly just to echo what Senator Cullinan said with regard to the age of consent, I tried and failed to bring forward an amendment to the Withholding of Information Bill in relation to consensual non-exploitative sexual activity where the age span is not more than 2 years, to try and in some way define what we're talking about, that access to medical support, advice and help. And the Minister has said he'll come back with a bill later in the year in relation to the age of consent. To look at the issue more. So I would be very interested, because I think it's an issue that we do need to examine. The reality is that teenagers in some cases are engaging in sexual activity, whether we want it or not, but it's to ensure that they are getting medical support and advice, and we're not deterring them away. So I would be interested in what you have to say. In listening to the presentations, I'm just slightly alarmed, because I have this feeling that everybody's going to be rushing on false reporting, and I feel this is an overemphasis, because for me, very clearly, the Children First guidance is for organisations. It's not for every member of the public. This is for organisations. It's guidance for those people who are working directly with children. And therefore, those organisations have to have procedures in place. They have designated officers. They train the volunteers. Like, I'm involved in the Girl Guides. I've been trained. I would never just pick up the phone to the HSE unless I thought a child was at an immediate risk. I go through procedures and support. So I'd be afraid that people would leave this meeting thinking that Children First guidance would lead to a flood of false reporting, because for me, Children First guidance is very directly, it's about frontline practitioners, it's about organisations, and to ensure that we have those robust in place. And certainly we had Dr. Buckley, who you've both cited in before us, but we've also had, for example, Dr. Shannon, who's the Government Special Rapporteur on Child Protection, who actually refuted that and felt he shared with us examples from several countries to demonstrate how you could have a triage type system where you could deal and ensure that complaints and reports were dealt with appropriately. So I just wanted to urge a note of caution that this isn't talking about every member of the public going to now be mandatory reporting. This bill will come in. This is about ensuring that organisations protect children who are within their care, and if they have a concern that a child is at risk in any way, that they need to share that with the appropriate services and supports, and that they have a statutory responsibility. And while we'd all think that morally should happen, the reality is it hasn't morally happened, and that for me is what the Children First guidance is. And then we have the Withholding of Information Bill, which is about offences. So where you know if an offence is happening, not about risk. So I think there is a balance here. So I just wanted to say that, because I actually got a little bit alarmed listening that we were urging people against reporting. I think systems have to have a way to deal with reporting. We have to encourage people to report the facts as they know them, not to escalate it. And I think part, for me, the problem with the current system at the moment is, in order to get a response, and I appreciate about supports and resources, but to get a response, people say, well, you need to escalate it. We need to calibrate a system that I can tell you the facts as I know them. So I just wanted to say that. Thank you.
Thank you. And we'll take Deputy Conway, who's intimated as well.
Thank you. And thanks again. I'm sorry I missed the first presentation, but I caught some of it on the monitor in my office. Again, I suppose I was, Senator van Turnhout kind of maybe has said maybe what I wanted to say, and I suppose the point I wanted to put to you is, what is the current practice in relation to the IMO in terms of their reporting?